OMT is osteopathic manipulative treatment. It's what our extra tool is. I think you guys pretty much summed it up. We're taught from a different philosophy. We are promoting health rather than disease. And a lot of MDs would say, well, I kind of do that too. Which, when you look at it now, like an osteopath that doesn't do OMT looks pretty much the same as MD. And when you get out there in the real world, we do OMT, which is correcting the body's structure through techniques that you learn while you're in school, while you're doing the 4 years. So there's so much I want to say. So you can ultimately, when you're in practice, you can decide, how much OMT you want to incorporate into your practice or, into your treatment of your patients. But, what was I going to say?
So basically, there's a belief, and it's proven that there is a musculo-neurological component to our bodies, right? So the way we move, when you exercise, you feel better, right? It's true. You feel better. And a lot of it is because the body is actually doing something to help heal itself, right? It's healing itself, it's improving itself. That's because of exercise. There's a lot of, a lot of resetting of the neurology. There's a lot of resetting of the vascular system, all that from exercise. So the other added component that we have is osteopathic manipulative techniques. So, I guess a typical situation, you come into the hospital, you see a patient that's lying on the bed, and we give them the drugs. We gave them all the drugs that they can have. But the component that they don't have, that's something that usually the allopathic counterparts don't emphasize, is how can you get your body to, I guess, better expand itself, better heal itself. So that's where we come in. And we go, okay, well, he's lying in the bed. His whole chest is compressed like this, So what does that mean? Basically, if your chest is like this, and you're just trying to breathe, right? What happens? Your lungs are all compressed. Your vascular system is all compressed. All of the neurosystems, the units inside here, they're not acting right. It's not acting the way we should be acting, right? So our job is, okay, we did all we can with the drugs, and what can we do with our hands? So we take our hands and we try to expand it. Because blood, vascular and neurology component is going to enhance that body system's ability to heal itself. And so there is proven evidence that those that are getting treated by OMT, as well as the drugs that are given, they have a better outcome of actually healing themselves. They have a better outcome of getting to the point where they're back into a stable condition. I think several studies of just the recovery process of added OMT. It's like a 50% difference. Those that got the OMT, they recovered a lot faster, by weeks, compared to those that didn't have that. So that's the other added component that we have to. And like Rhiannon said, when it comes to OMT, not everyone's going to use it. DOs and MDs, it depends on how much you want to use it.
Sorry, go ahead. I also want to add that in osteopathic school, you sort of are taught to touch your patient, and there is a very powerful therapeutic healing power with your touch. And with that, you can build a stronger relationship with your patients. I have friends who's going to a very prestigious allopathic school in San Francisco right now, and I guess my vet school. But when I ask him about how often does he, touch the patient, does he know where this component is, how this system is affecting another system, he's a little bit clueless about that. And having this in your tool belt, it helps you so much with sort of looking at the greater picture. After you give them drug therapy, after you give them, all the sorts of allopathic give, you can give them also OMT.
I think it's just to add to what they've been saying, is they did a great job describing it. I was thinking, what else can I add? There's just a lot, and there's just a lot, and just to think about like our first year, how much we learned is really the emphasis was help the body heal itself. Like you could give it the drugs just to kind of keep the the pathogens from gaining ground or whatever, but you could also help it by one of the things that we learned was like lymphatic drainage and things like that. So like your lymph system circulating around and picks up all the waste, all the crap, and kind of tries to get rid of it. But when you're sick, things like that can clog up because you have a lot of it. So we're taught to kind of help promote the lymph drainage system by doing certain manipulation techniques. The one example I can actually think of that we learned the suboccipital release. So and actually the week after we learned that, I went down to Davis because I was visiting some friends, and you guys had like your midterms. And my friend's like, I have a terrible headache, and she's like, and so she asked her sister for some ibuprofen. I was like, wait, can I try something on you? So I actually did it, and her headache went away. Like it was awesome because we just learned it that week, And her headache went away, and it was gone for like a couple days. And so she was able to sit down and study. And now it's like every time I talk to them, they're like, when are you coming down? I like that thing you did with the neck. It feels really good. So, it helps you avoid pills in certain situations because a lot of times the stuff that we do, we relax the muscles, let the blood flow back in, not just turn off the nerve impulse, So there's that component. And like JD said, we can, as DOs, we can prescribe medication. There are DOs that do surgery, so it's everything else is the same. You just have this one extra tool, which is helpful a lot of times.
There's no limit to subspecialties, so if you want to go into a really specialized field, you can go into, there's no limit.
I think that's what you brought up a really good point. Like, I do OMM all the time with like family and friends. Like, over winter break, I was home for 2 weeks. I played at OMM like on 10 or 20 people. Like, anyone that came to my house, they had some kind of pain. I was like, okay, and I did something. And I mean, a lot of times they have relief, and that's the best feeling in the world. Like, to be a second year in med school and to actually help someone and treat their pain, and figure out what's causing their pain. And I know in your first year you learn a lot, but in your second year you just learn a lot more, like things that I think are more applicative. Like we learned, like a full headache protocol to treat headaches. We learned how to treat patients in the hospital that are having trouble, with their bowel movements or whatever. Like we learned so many different techniques, and you can apply them with anything. Like I remember during one of our labs, like there was a lot of like abdominal stuff, and like everyone was going to the bathroom right after the lab, just because like who's doing the bowels, So I mean. It's just a lot of it's so applicable, and you can help anyone. That's what I love about it.